Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.
Welcome back. This is Dr. Jeremy Stich. This is Thursday, April 9th, and we welcome you to the COVID update for today. Let's begin with United States epidemiology. As of Wednesday evening, the CDC reports 427,460 confirmed cases and 14,696 deaths in the United States, with a case fatality rate of 3.44%. Now, this case fatality rate seems high, but again, we are testing patients who are most symptomatic and most sick. We're not doing lots of general population testing at this time, so this may be skewed. As of this afternoon, the Worldometer reports 454,615 cases and 16,074 deaths in the United States, and approximately 1.58 million cases and 93,500 deaths around the world. In global updates, data from the Financial Times shows that the daily new cases in the United States and the United Kingdom may be slowing down, which is great news. The rate of increase in the cases in the United States, however, is still a little bit steeper than other countries at the same stage in this pandemic. The number of daily new deaths continues to rise in both the United States and the United Kingdom, but the UK appears to be tracking Italy and may even be leveling off while the United States seems to be rising sharply. The highest cumulative death toll is currently still in Italy, which has seen more than 17,000 deaths. The United States is on course to surpass that number by next week. In U.S. news, for the third straight day, New York reported its highest single-day death toll. In his daily debriefing, Governor Cuomo reported 799 new coronavirus deaths in the past day, bringing the total death toll in the state to more than 7,000. However, the decreased rate of hospitalizations also continues to hold. 2 weeks ago, the number of hospitalized patients was growing by 20% per day, but by yesterday, the daily increase had fallen to just 1%, a sign that the outbreak in New York may have passed its peak. Yesterday, the CDC released a new report suggesting that approximately 90% of hospitalized patients for coronavirus had at least one underlying medical condition. The most common of these conditions were high blood pressure, obesity, chronic lung disease, diabetes, and coronary artery disease. Once again, emphasizing the importance of preventative measures for these vulnerable populations. This study, based off of data gathered from nearly 1,500 coronavirus patients that were hospitalized across the country in March. The study also found that people over the age 65 are more likely to be hospitalized, and men seem to be at risk for more severe cases compared to women, which is further supported by the general trends in the current literature. Finally, the CDC also released new guidelines detailing how, quote, essential employees, end quote, who have been exposed to the virus may return to work. And this report differs from previous guidelines, directing anyone exposed to the virus to self-isolate at home for 14 days before returning to work. Specifically, employees that have been exposed but are asymptomatic may return to work as long as they pre-screen for symptoms before going to work, wear a mask at all times, practice social distancing, maintaining 6 feet of distance whenever possible, and routinely disinfect all shared workspaces and equipment throughout the day. Let's move on to some FAQs. One question that we continually are posed with is regarding the use of N95s, and specifically the question is, how long can N95 masks be used before they are no longer effective? And I'll be honest, the data on this is not very clear. There is a great article in Sages reporting N95 reuse strategies, but this and other literature points to this one commonality that, depending on the use and the way that these are reused, could affect their longevity. So I apologize, we don't have an obvious answer on that one. We'll dig into that. In announcements, we are continuing to release the summit content through our podcast, and we know that there is a lot of information here. So we are working on compiling a detailed summary from each speaker, and we will try to release that once we have it finished. So more information to come. Moving on to research updates. There was an article, a letter to the editor specifically in a large pharmacologic journal, suggesting that tetracyclines could be useful in COVID-19 and details the mechanisms by which that might happen. The authors suggest that their ability to chelate zinc and thereby inhibit RNA replication of positive sense ribosomal RNA could potentially treat COVID, and cited another study where doxycycline was used to reduce viral load by 70%. Another mechanism by which tetracyclines could be useful is by decreasing inflammation and downregulating NF-κB and cytokine pathways. Tetracyclines are also lipophilic, which could allow good penetration of the drug into the COVID-19 virus envelope. The authors suggest, as many have, that ongoing research attempts and more trials will be required, but that these medications could be safer than the antimalarials and antiretroviral drugs that could operate with a similar mechanism. Another interesting article is titled TPA, or Tissue Plasminogen Activator, Treatment for COVID-19 Associated Acute Respiratory Distress Syndrome, or ARDS, a case series from April 9th. This case series highlights coagulopathy as a hallmark of severe COVID-19, with DIC, which stands for disseminated intravascular coagulation, being responsible for 71.4% of all COVID-19 deaths. Now, DIC is a severe reaction by which the coagulation cascade is disrupted, and it's clear that critically ill patients with COVID-19 experience this prothrombotic DIC with pulmonary congestion due to microvascular thromboses. This suggests that the use of thrombolytic therapy as a treatment for ARDS associated with COVID could potentially be useful. Now, if you recall or listened to the summit, Dr. Scott Weingart actually suggested this, that the TPA could actually be used as a standard of care. So more to come on this. We'll definitely be paying attention. Finally, our last article comes from the JAMA Network, entitled Baseline Characteristics and Outcomes of 1,591 Patients Infected with SARS-CoV-2 Admitted to ICUs of the Lombardy region in Italy. This article was from April 6th. This study characterizes the population that was infected by SARS-CoV-2 and was admitted to the ICU in Italy. The average age of these patients was 63, and 82% were male. 68% had at least one comorbidity. About half had hypertension. Now, of these patients, 88 required endotracheal intubation and mechanical ventilation, and 11% required non-invasive ventilation. And the mortality rate in the ICU setting in Lombardy, Italy was 26%. So this study does help characterize somewhat more clearly what we already know about comorbidities. So thank you for tuning in. Please tune in for more updates, and we appreciate your time listening. Thank you. Stay safe.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.